Hi, I'm Morgan Davis, and this is my research on illness uncertainty and transition readiness among college students with a chronic medical condition. Implications for avoidance and reassurance seeking. This study was conducted with college student, adolescent, and young adults with self-reported chronic medical conditions. We wanted to assess how perceptions of one's own illness influence adolescents and young adults in developing their independent healthcare management skills to transfer from pediatric to adult healthcare. Specifically, how perceptions of illness uncertainty influence this transition readiness. Illness uncertainty is a cognitive appraisal of the extent to which an individual perceives their chronic medical condition as uncertain or unpredictable. For example, not being able to plan for the future because of the unpredictability of illness. We hypothesize that these perceptions of illness uncertainty may lead adolescents and young adults to cope by avoiding healthcare or cope by seeking reassurance from healthcare. Avoidance might look like not going to the hospital for treatment, whereas reassurance seeking might look like consulting your family doctor. For those that avoid, they might be less likely to develop the transition readiness skills needed to independently manage their healthcare because they are not actively engaging with healthcare. On the other hand, for those that seek reassurance for their uncertainty from healthcare providers, they might be more likely to develop transition readiness. In the present study, we assessed how these two different coping mechanisms mediate the relationship between illness uncertainty and transition readiness among 126 college students. Participants completed online measures, including the Transition Readiness Assessment Questionnaire, Michelle's Illness Uncertainty Scale, and Short Health Anxiety Inventory, of which we utilized the Avoidance and Reassurance-Seeking subscales. Two mediation analyses were conducted using the SPSS process macro, with avoidance and reassurance seeking as mediators, respectively, with age, sex, education, first-generation college student status, and combined caregiver annual income as covariates. The avoidance-mediated model was significant, with avoidance mediating the relationship between illness uncertainty and transition readiness. The reassurance-seeking mediated model approached significance with no significant indirect effect. However, there was a significant direct effect of illness uncertainty on transition readiness. These findings suggest that the relationship between illness uncertainty and transition readiness is partially explained by avoidance-mediated coping. Specifically, adolescent and young adults experiencing more illness-related uncertainty may cope with these feelings by avoiding healthcare needs and therefore are less likely to develop transition readiness skills. This is important to note because avoidance may lead to decreased independent healthcare management. Interventions to develop active coping with illness uncertainty may improve transition readiness in adolescent and young adults with chronic medical conditions. Future research should examine factors that may influence adolescent and young adults' use of avoidance versus active coping in response to illness uncertainty, such as parent management of illness, access to healthcare, negative experiences with healthcare, and developing transition readiness. Thank you, and that's the end of my slideshow.